provided by the primary supports. Besides that, there are also secondary supports. They are the just the ligaments held to the uterus, even though they don't provide primary support, but they are the structure that is attached along the uterus. Okay, those are the broad ligament. Okay, uterovesical fold of peritoneum. See here, this is the parietal peritoneum gets reflected onto the surface of the urinary bladder, and at the level of isthmus it get reflected, and this reflected part it will form the uterovesical. Utero means uterus, vesicle means the urinary bladder. Uterovesical fold of peritoneum, then it will cover the fundus, then body, then isthmus, the cervix go up to the this posterior fornix. Posterior fornix ma gayeपछि चाहिँ then it get reflected as the rectovaginal fold of the peritoneum. Okay, now we'll be talking brief about broad ligament. Broad ligament is the fold of peritoneum passing from side of the uterus to the lateral wall of the pelvis on each side. You have already seen this before also. This is the uterus. From the lateral wall, the sheet of the peritoneum passes from the lateral wall to the pelvic wall. Okay, and they are further classified as the mesosalpinx, mesometrium, and mesovarium. See here, you can see this also in the figure. This is the fallopian tube, and this is the ovary, and the part of the broad ligament that passes and surrounds passes to surround the fallopian tube is the mesosalpinx, and to the ovary it is mesovarium, and finally it goes to the lateral wall of the pelvic cavity and gets attached over there. It also has a part that is the suspensory ligament or the infundibulopelvic ligament. Now the contents. We have already seen in the class of the ovary also the content of the broad ligament. One tube, this is the uterine tube. Then two ligament. One is the round ligament of uterus. Next is the ligament of ovary. I think you are familiar with these two terms by now. The next structures are the two arteries. They are the uterine artery and the ovarian artery. See here, along this wall the uterine artery passes, and along the suspensory ligament the ovarian artery passes, then passes through the mesovarium, then enters into the ovary. Its branch also passes medially. See here, the broad ligament also passes through the broad ligament, and the important vessel pass, that is the uterine vessel. Okay, this is the uterine vessel. It also passes laterally, and these two uterine and the ovarian vessels, they will form the anastomosis. Okay, so besides the arteries, there are also plexuses of nerve. Those are the uterovaginal plexus, that is around this uterus and vagina, and next is the ovarian plexus. Those all are present within the broad ligament. Are you getting all of you? Besides that, there are also embryological remnants. Okay, we will be I'll be teaching about each remnant when we study the embryological class, the class on embryology. Okay, they are para-upufuran, upufuran. Those structures I will tell you in detail in the coming class. Now just remember, within the broad ligament there are the remnants of the embryological remnants, and also lymph vessels and nodes and fibroareolar tissue. Those all are the contents. They are present within the broad ligament. Are you clear, all of you? Contents of the broad ligament?
Yes, ma'am.
Okay. Now, the applied aspect related with this, it is the uterine prolapse. I was telling you in the last class also, the main purpose of the support of the uterus is to hold it in its normal position. If there are certain problem in any of the support, what may happen is the uterus that is placed within the pelvic cavity may descend down through the vagina. See here, you can see this is the vagina. Okay, and this is the normal position. It should be initially positioned over here, but if there are some weakening of the support, such as especially the cardinal ligaments, what is the other name for this cardinal ligament? What is the other name for this cardinal
Transverse
ligament?
ligament of uterus.
Okay.
Oh,
If
McIndoe.
this is the major support, our uterosacral or levator ani muscle, then the uterus may come out through the vagina, and that condition is known as the prolapse of the uterus. Now we'll move on with the histological features. I think you have some idea about these features while studying about the fertilization in the first class, in the first year. There are have three layers: endometrium, myometrium, and perimetrium. I think you are familiar with these terms. Where does implantation occur? In which layer?
Posterior part of fundus.
And that is the region that is in the ovary, that is in the uterus. Okay, it occurs in the posterior body wall of the uterus. That is, but talking about the histological features, कुन लेयरमा चाहिँ गएर अट्याच हुन्छ होला?
Endometrium. Endometrium.
Okay, now we'll continue with the endometrium. Endometrium is further divided as stratum basal, stratum spongiosum, and stratum compactum. This stratum spongiosum and stratum compactum are known as functional layer or stratum functionalis. Why do you call this? Because you have already studied the structures in your first year. So I'm asking you the question, why are they called as functional layer?
So menstruation को बेला शेड होने
Very good. During the time of menstruation, this layer is sloughed off. So this layer, the spongiosum and compactum, they are known as the functional layer. See here, you can find here the lining epithelium. It is lined by the columnar epithelium. Before menstruation, there may be presence of some ciliated epithelium, but most of them, they are lined by the simple columnar epithelium. That is the lining epithelium. Now, underlying structure, you have the stroma, and within the stroma, you can find the blood vessels and the glands over here. Okay, I think you know the changes that occur in this structure during proliferative stage and during secretory stage of menstruation cycle. Do you know or not? What happens during proliferative stage? What happens during menstrual stage? And what happens during secretory stage? Anyone? Which layer? What happens? We have just given exam of the first year, both group MBBS as well as BDS. You have studied about menstrual cycle. Did you do histological correlation? के हुन्छ त भन त यसमा हेर त now you can what is the role of proliferative stage, what is the role of the secretory stage?
proliferative चाहिँ prepare uterus for implantation or baby.
Proliferative and secretory अनि के चेन्जेसहरु हुन्छ होला त प्रोलिफरेटिभमा के चेन्जेस हुन्छ होला? ओके during menstrual cycle your slough off हुन्छ, so healing हुन्छ, then what happens? Okay. And proliferative र सेक्रेटरीमा के हुँदै जान्छ त? अब के हो त प्रोलिफरेटिभ सेक्रेटरी भनेको चाहिँ युटरसलाई चाहिँ and gland also. Initially, it was a tubular gland. Now there will be more accumulation of the substance, and the gland becomes enlarged. Okay. Okay, good. You need to know that structure. सबै फर्स्ट इयरमा भएको यो रिभिजन हुँदैन. Please do the correlation and study. Correlation, what happens during menstrual cycle in the uterus. Now, this year we are just teaching you what are the layers that are seen. That is, in the endometrium, you'll see functional layer and the basal layer. Functional layer are the layers that are sloughed off, and you have to know. Now, next is this layer. This is the endometrium. Okay, endometrium, here you have the lining epithelium, and within the lamina propria you will find large number of glands along with the blood vessels. Okay, and what are the changes in the blood vessels and glands, you study yourself. And now next layer is the muscle layer, that is the myometrium, right? Unlike other structure in a circular outer longitudinal भन्दा नि यसमा चाहिँ a definitive orientation हुँदैन, different planes the muscles are arranged. Okay, they are thick myometrium, and outermost layer is the perimetrium, the connective tissue along with the lining mesothelium. That is the histological feature. Now, next is the arterial supply. Its arterial supply is also very important. Artery, it is supplied by the uterine arteries and partly by the ovarian artery. I have said from the previous class itself, there is anastomosis between the uterine and the ovarian artery. So the ovary is also supplied by both, and the uterus is also supplied by both. Okay, the uterine artery is the branch of the anterior division of the internal iliac artery. I think by now each and every aspect I cannot go in detail. Please study yourself about the internal iliac artery. Okay, internal iliac artery. When do you say the artery as internal iliac? Then, after entering into the pelvic cavity, internal iliac artery divides into anterior and posterior division. Please study about the branches that arise from the anterior as well as the posterior division. All of you, okay? Okay, so this internal iliac uterine artery is another branch of the internal iliac artery. And next thing you have to know its correlation with the ureter. Now see here, internal iliac artery is present in the posterior wall. See here, this is the pelvic cavity. Okay, this is the posterior wall and this is the anterior wall. Here you can see the uterus. Okay, and on the posterior wall, this yellowish structure, can you see? This is the ureter. The ureter is passing, and there is this artery is also passing. Okay, and at the lower region, in the region of the cervix where it enters the uh, uterus. Okay, here it is crossed by the ureter. This point is very important to note. Right? It This uterine artery crosses the ureter on both sides. Okay, note this point, all of you. So this relationship is very important, especially during hysterectomy. अब के हो त uterus निकाल्नको लागि, if you have to ligate this artery, you have to take care about the ureter, because ureter is intimately related with this artery. Now next is the venous drainage. Venous drainage, I think I have told you the course. It arises from here, then it follow a tortuous course. Why there is tortuous course over here? Anyone? The uterine artery are tortuous.
Because during pregnancy the uterus get enlarged, so the artery also and then also get chance to enlarge.
Very good. During pregnancy, the uterus is hypertrophied. Okay, the uterus becomes large in size. If this artery is not tortuous, then if the just the uterus expand, then there may be chance of rupture of the artery. So in order to prevent that phenomenon, God has created tortuosity in the uterus. And next is the venous drainage. It also forms plexus around the lateral border of uterus and finally drain into internal iliac vein. Now, next is the lymphatic drainage. Lymphatic drainage is also important because this organ, even though it is situated into the pelvic cavity, it has its lymphatic drainage in the external body wall. Now see here, upper lymphatic from the fundus and upper part of the body drain into aortic and partly to superficial inguinal node along the round ligament of uterus. At the upper border, where there is attachment of the fallopian tube, just below that there is attachment of the round ligament of uterus. You have all of you have seen this. So some lymphatics, most of the lymphatic passes in the aortic lymph node, but some lymphatics along with this ligament goes to the superficial inguinal lymph node. So you have to find out if there is enlargement of the superficial inguinal lymph node. Okay, the infection or some metastasis has occurred from some visceral organ also. You have to take into consideration. Okay, because the superficial region or superficial inguinal lymph node has its drainage from the uterus as well. Lower lymphatic from the cervix drain into external iliac, internal iliac, and sacral lymph node. Middle lymphatic from the low part of the body drain into external iliac lymph node. So please study about the lymphatic drainage as well. Now, next is the age changes. And I'll just give you some points. Please study yourself properly. Age changes. Until puberty, cervix and body are almost equal in size, but after puberty, the body enlarges, and during pregnancy, it increases up to 30-fold. Okay. Uh, now I'll be talking you about the external genitalia. Now we'll be talking about lower genital tract. Upper genital tract we have finished, which included ovary, fallopian tube, and the uterus. Now we'll be seeing the lower genital tract. Regarding lower genital tract, it consists of the vagina and the vulva. Okay, there are a number of structures that forms the vulva. We'll be seeing now. First, we'll see the vagina. Okay, so vagina is a fibromuscular canal forming female copulatory organ. It extends from the vulva to the uterus. It is situated behind the bladder, urinary bladder, and urethra. It is related anteriorly with the bladder in the upper part, and in the lower part, it is related to the urethra. And behind it lies the rectum in the upper part and anal canal in the lower part. See here. This is the vagina. Okay, this is the anterior fornix, posterior fornix. So talking about its relation, in the upper part, it is related with the urinary bladder, and inferiorly, it is related with the urethra. Posteriorly, you see here in the upper part, it is related with the rectum, and in the lower part, it is related with the anal canal. And next is the direction. In erect posture, vagina is directed upward and backward. You have already seen this in the figure. And the long axis of vagina forms 90-degree angle with the uterus. You know this by now. All of you know the retroversion by now. Now regarding the size and shape. Okay, anterior wall. This is especially asked for your viva or MCQA. Length of the vagina. Anterior wall of the vagina, it is relatively shorter than the posterior wall. Okay, so the length of the anterior wall, it is 7.5 centimeter, whereas the posterior wall, it is 9 centimeter. Right? During your viva or in your MCQ, you may be asked about the length of the urethra, length of the vagina, length of the male urethra as well as female. Male मा पनि different parts को कति कति हुन्छ. You have to know, all of you. Okay. Next is the anal canal. त्यसको पनि सोधिरहेको हुन्छ है. And next is the diameter. Diameter increases from downward to the above, upper part. Okay, at the lower end, it's around 2.5 centimeter, whereas in the upper end, it may be 5 centimeter. Lumen is circular at the upper end. I have showed you in the last class also. The cervix opens into the vagina. So the vagina encircles the cervix. So the upper part becomes the circular. And below the cervix, anterior and posterior wall are in contact with each other. So the lumen over here is the slit. Okay, and in the lower part, the lumen becomes H shaped. In virgin, lower end of vagina, especially in the region of opening. This is the opening of the external genitalia. Here you have the opening of the vagina. Others I'll be showing you in the next slide. Here you have the H-shaped opening. Okay, this is the opening of the vagina. Okay, at the lower end. And in virgin, the lower end of vagina is partially covered by thin annular fold of mucous membrane, which is called as hymen. Next is the vaginal fornices. Fornices I have showed you in the last class about the uterus as well. It is the regions around cervix. This is the space between the vagina and the cervix. There is anterior fornix, posterior fornix, and two lateral fornices. Okay, the posterior vaginal fornix is the deepest. Okay, and posterior it is related with the rectouterine pouch of Douglas. Next is the arterial supply. Um, the upper part it is supplied by the uterine artery, whereas medial and inferior part it is supplied by the vaginal and internal pudendal artery. Next is the venous drainage. The vaginal vein also forms the plexus. Okay, and this plexus communicate with the uterine plexus as uterovaginal plexus, and finally drain into the internal iliac veins. And this also communicates with the rectal as well as the vesical venous plexus. Next is the lymphatic drainage. There are also three groups of lymph node: upper one third, internal and external iliac lymph node that will follow the venous drainage or arterial region. So drain into the nearby structure, that is the iliac node, and in the middle part into the internal iliac node, whereas in the lower one third, medial group of superficial inguinal node, that is in the region of the opening. Okay, they are drained into superficial inguinal lymph node. These inguinal lymph nodes are very important. You have been studying this from the first year. Please note wherever there are given superficial inguinal nodes, please note it specifically. Next is the nerve supply. Upper two-third insensitive outermost layer, it is the adventitia. Okay, are you getting all of you? Yes or no?
Yes, ma'am.
Okay, now we will be studying about the genitalia, okay, and the part of the lower reproductive tract. It includes mons pubis, labia majora, labia minora, clitoris, vestibule of vagina, bulb of vestibule, and greater vestibular gland. Now you will be seeing all these structures in detail. And next, what you study over here is the openings that are related to the external genitalia. Okay, we'll be seeing each of the structure in detail. First is the mons pubis. Okay, this is the rounded eminence in front of pubic symphysis over here. Okay, it is formed by the subcutaneous accumulation of the fat. So this area there becomes covered with the pubic hair after puberty. This is the subcutaneous region. Okay, fatty accumulation you find in front of the pubic symphysis. Next is labia majora. There are present on either side. So labia majora, and if it is single, labia majus. They are a pair of prominent longitudinally placed cutaneous elevation. This is the elevated part. Okay, and if they are separated from each other by a cleft present over here, which is known as the pudendal cleft. Okay, and each labius majus contain fibrofatty tissue and some muscle. Underlying this ridge, it is produced by the fibrofatty tissue along with some muscle, and these muscles are known as dartus muscle. Dartus muscle is present subcutaneously over here, and fibrofatty tissue is present. So this structure causes elevation of the area over here that forms the labia majora. Okay, and this structure, it is homologous to the scrotum of the male. The larger anterior end are connected to each other. See here, this is the anterior end and this is the posterior end. Towards the anal canal, it is the posterior end, and the other side, it is the anterior end. Okay, the anterior end are connected to each other below mons pubis to form anterior commissure. Okay, this is the anterior commissure where two the labius majors of either side gets joined. Okay, and the skin connecting the it is less prominent in the posterior commissure. See here, the anterior joining region over here, they are anterior commissure, whereas the posteriorly they are known as posterior commissure. Okay, and area between the posterior commissure and the anus is about 2.5 centimeter in length. This is the opening of the anal canal. This is the posterior commissure. The distance between these two, it is 2.5 centimeter long. Next structure is the labia minora, the outermost fold, the prominent ridge, that is labia majora, and next fold, okay, it is opened over here. This folding, it is known as labia minora. Okay, labia minora are two thin folds of skin that lie within the pudendal cleft. Okay, we have already seen these two labia majora enclose the underlying structure that is known as, and a groove is present in between that is known as pudendal cleft, and in this cleft there is presence of labia minora. It is thin elongated fat free just cutaneous tissue is present without fatty tissue here. It is just the layer of the skin. Okay, the cleft between labia minora and the cleft between two labia minora is the vestibule. So we have opened the labia minora of either side so that we have seen the space in between, and this space, it is the cleft, it is known as the vestibule. Okay, it presents the external orifice of urethra and vagina. See here, there is the opening of the urethra, and below there is accept opening. We have already seen that is the opening of the vagina. Okay, and each labius minor splits into upper and lower layer. Now see here, this is labia minora. They are present on either side. The space between two labia minora, it is the vestibule, and in the vestibule, two very important structures open. One is the urethra, next is the vagina. Okay. Now, anteriorly, each labius minor splits to two layers. Now, if you see over here, this is the anterior, this is the posterior. Okay, it will split here. See here, it has splitted into two parts. Okay, and here this is one and this is next. Upper layer joined with the opposite that of the opposite side to form the prepuce of the clitoris. You have already seen glans penis, okay, and its prepuce. Okay, glans penis is equivalent to glans clitoris. Here, at the anterior region of the labia minora, you will find this glans clitoris. Okay, so this glans clitoris, it is covered anteriorly by a prepuce, which is the extension from the labia minora. Okay, and the lower layer of either side fuse to form frenulum of the clitoris. See here, this has splitted. Lower end will form the frenulum of clitoris. Upper part will form the prepuce of the clitoris. Got it? And this part, it is equivalent to the glans penis, that is the glans clitoris. Posteriorly to labia minora fuse and they will form the frenulum of the labia minora. Okay. Inner surface of labia minora contains numerous sebaceous glands. Next is the gap in between two labia minora, that is known as vestibule. Vestibule intervene between two labia minora extends from the frenulum of the clitoris to the frenulum of the vestibule. Okay, and it possesses two opening, as I said previously, urethra and the vagina. Urethral opening presents a sagittal slit situated 2.5 centimeter from the clitoris. The distance between the clitoris and the urethra is again 2.5 centimeter. It is a sagittal slit. I think you have studied about the shape changes of the urethra as well. In the male mapani kun kun part ma ke huncha, similar is in case of female. So it presents a sagittal slit over here. The vaginal orifice lies behind the urethral orifice and it has S-shaped slit. A mucus fold, that is hymen, they may be present in the virgin female, okay, which ruptures in the other female. In married, this hymen it is represented by rounded tags of tissue called caruncle hymenalis. Once there is sexual intercourse, this hymen gets ruptured and this remnant forms the caruncle hymenalis. Next is the orifice of the greater vestibular gland lie on either side of the vestibular orifice between hymen and labius minus. यो hymen र labia minora को बीचमा there are small openings. They are the openings for greater vestibular gland. We'll be seeing the gland in the next slide. Okay. Besides this greater vestibular gland, there are also minor vestibular or lesser vestibular gland that are present and opens into the floor of the vestibule. Clear, all of you? The openings over here, the labia minora opening for the greater vestibular gland, then opening for vagina, the urethral orifice. Next is the clitoris. Clitoris is in the next slide. Now just read the overlying covering. It is the glans clitoris, and below that you have the frenulum of the clitoris. Next is the urethra. Urethral opening, you have already seen, 2.5 centimeter below the clitoris. It is the sagittal cleft. The duct of the paraurethral gland, that is the skinous gland, also open on the lateral margin of the urethra. Urethra ma chai paraurethral gland ko opening is present at this point. Next is the clitoris. Clitoris is the erectile organ homologous to penis. Okay, you have to know some of all most of the homologous structure. Okay, scrotum, it is homologous to labia majora, and similarly clitoris, it is homologous to penis, because both of this structure, whole of the penis is equivalent to just the clitoris. The small structure, projected structure, you can find it over here, that is the clitoris, which is equivalent to the male penis, because both of this structure contains the erectile tissue. Okay, so it is a erectile organ, but the major difference between the penis and the clitoris is the penis. Through the penis, urethra passes. Okay, spongy urethra passes and opens to the external. Whereas in case of female, there is separate erectile organ and urethra doesn't pass through it. It passes 2.5 centimeter below the clitoris. Okay, it lie on anterior part of the pudendal cleft. The body of clitoris is made up of pair of corpora cavernosa. What is the penis made up of? What? कर्पस स्पोन्जियोसम र कर्पोरा क्याभर्नोसा नै हुन्छ है। यसमा चाहिँ के हुन्छ त भन्दाखेरि बडीमा जस्ट कर्पोरा क्याभर्नोसा मात्रै हुन्छ। ओके, सो अट्याच टु दिस see here, this opening, it is clitoris. This is the body. Okay, body ma you can see the corpora cavernosa. Okay, they are corpus cavernosus of either side fused to form corpora cavernosa that forms the body, and in the anterior part, then it divides into two parts. One goes towards the right, next goes towards the left. They are known as screws. Okay, and these screws, they are then covered by the muscle. That muscle is similar in case of male, that is the ischiocavernosus. Free end of clitoris is formed by a rounded tubercle. This is the free end. Okay, the free end, it is known as glans clitoris. What it? The glans clitoris, the body of the clitoris, glans clitoris, the screws covered by ischiocavernosus muscle. Clear? Please, while studying about this, please do the correlation with the male so that it will be easy for you to remember. Right? Free end is clitoris. Clitoris covered by prepuce. Prepuce is formed by the in the anterior region by splitting of the labia minora. I think you people are getting these points. Now, next is the bulb of the vestibule. Okay, corpus spongiosum in female is represented by bulbs of the vestibule. Now, see the difference between the male and female. There is three structures. They are present within the male penis. They are present together. Whereas in case of female, okay, the clitoris will have just the corpora cavernosa, whereas corpus spongiosum is not attached with the clitoris. It is attached here separately. Okay, they are the bulb on either side. Okay, bulb of the vestibule is the corpus spongiosum in female. Okay, in case of female, the corpus spongiosum forms the bulb. It is a pair of elongated erectile tissue that embrace the orifice of the vagina, okay, as well as the urethra. Okay, this is the bulb of
hello,
the.
Hello, 1, 2, 3, 1, 2, 3. Hello, 1, 2.
Who is this? Any problem?
केही बुझेन म्याम फेरि पढाइदिनु न
Who is this iPhone?
मैम बाहिरको कोही होला यहीँको भए नाम लेखेर आउँथ्यो
छैन है त्यही भनेको यसरी डिस्टर्बेन्स आउँदैन नि क्लासमा आउँदैन त ओके ब्लक गर्न मिल्दैन यिनीहरूलाई वेटिङ रुम मोडमा गएर एनेबल वेटिङ रुम गर्ने होइन अनि गएर आइफोनलाई गरिदिने खै त आइफोनमा गएर अनि के भने मोडमा गएर भयो है सदीक्षा खड्का भने त हाम्रो स्टुडेन्ट हो नि होइन ऊ पनि वेटिङ रुममा रहेछ ठिक छ है बुझिरहेछ नि
Yes, ma'am.
Okay.
Ma'am.
Okay, so this is the bulb of the vestibule भयो हैन. It is a elongated erectile tissue that embraces the vaginal orifice. Okay, the bulb lie on either side of the vaginal and urethral orifice. Okay, and it is continuous in front with the glands. Next is the greater vestibular gland or the Bartholin's gland. We have already seen the opening of the greater vestibular gland. Okay, that is in between the labia minora and the vestibule. You could see a small opening of the vestibular gland. Now we will be seeing what is this gland. This is the other name for the greater vestibular gland is the Bartholin's gland. Okay, it is homologous with the bulbourethral gland of male. Below the prostate, in the perineum, there was presence of the bulbourethral gland, okay, which opened into the penile urethra. You have seen that structure. So equivalent to that structure, and the structure is present, okay, that is known as the Bartholian or the greater vestibular gland. A pair of mucus secreting gland. They are situated behind the bulb in the superficial perineal pouch. They are also present in the perineum. So it corresponds with the bulbourethral gland, and their ducts open in each sides of the vaginal orifice below hymen. Okay. Now, next is the breast or the mammary gland. Mammary gland, you people have already studied in the first year, right? Second year ko syllabus ko kura garदाखेरि second year ma चाहिँ what you need is just the histological part. Breast falls both in the reproductive system र MSK को upper limb मा नि पर्छ है. So our curriculum has divided it into two parts. अब gross features अरू सबै चाहिँ first year मा पढ्ने रे, and just the histological feature will be studying in the second year, है. भएको छैन र भएको छैन हुनुपर्ने हो त सिलेबसले त त्यस्तै भन्छ. भएको छैन भने ठिकै छ, म पढाइदिउँला. आज जस्ट म हिस्टोलोजिकल एउटा क्लास राखिदिन्छु नि त, किनभने तिमीहरूको क्लास पुगि नै हाल्छ. ठिकै छ, म एउटा क्लास चाहिँ मेमोरी ग्ल्यान्डको राखिदिन्छु. आज मैले जस्ट स्लाइड राख्दैछु यो उसको हिस्टोलोजिकल फिचर. जस्ट फोकस अन द्याट. नेक्स्ट पार्ट विल बी बिडिएसको चाहिँ होला है, नभएको फर्स्ट इयरमा कि एमबिबिएसको पनि हो? करिकुलममा त थियो होला हैन
मैम बीडीएस
डिप्लोमा पढ्ने भन्नुभएको थियो
हैन? पढ्ने त हो कि, तर सिलेबसमा चाहिँ किनभने अस्ति करिकुलम रिभ्यूमा म आफै थिएँ, त्यसरी नै बनाएको थियो कि. ठिकै छ, म पढाइदिन्छु, के फरक पर्दैन.
ग्रोसमा ड्राइङ मात्रै बनाएको त्यो ग्रोस फाइलमा ड्राइङ चाहिँ बनाएको, तर पढाउन चाहिँ भएको छैन.
ठिकै छ, म पढाइदिउँला, के फरक पर्दैन. एउटा क्लास एक्स्ट्रा हो, म लिदिन्छु नि त. आज चाहिँ जस्ट हिस्टोलोजिकल फिचरमा चाहिँ भनिदिन्छु कि हिस्टोलोजी पनि सँगै गर्छु नि त. ल, आजको टाइम पनि सकिन लागिसकेको छ. कति भयो टाइम? ठिकै छ, आजको क्लास म यति नै स्टप गरिदिन्छु. ब्रेस्ट र म्यामेरी ग्ल्यान्डको हिस्टोलोजी ग्रस सबै एकैचोटि लिदिन्छु है त. अनि म एन्ड गरिदिन्छु क्लास.
थ्याङ्क यू म्याम.
वेलकम.